All right, y'all. So I'm Dr. Amaka, board certified plastic surgeon. Today we are talking about implant massages. So we do breast implants typically under muscle in our practice. And with that said, what happens is sometimes the implant can sit pretty high because the muscle kind of tightens and squeezes that implant. So what we do is advise our patients on different types of implant massages, 3 massages specifically that they can do to help the implant settle over time. So the first one we're going to talk about is the implant displacement. This one is the one that can be the hardest to do, but I'm going to do my best to try to explain that to you with our amazing model who has volunteered to kind of help us show you. Okay. So when you think about implant displacement, what are we doing? We are trying to push the implant down into the pocket where we want it to be. So the first step with this is to use 2 to 3 fingers. I like to use 2 fingers, and you put it right above where the nipple is. So her nipple's right here. My 2 fingers are right above that. I usually hold patients at the back when I do this because that tells you about how hard you are going to be pushing on the chest wall. So now what I do is I lift up like this, and what you can appreciate is my hands are going up, the skin is moving up, the implant is moving down. How do you know you're doing this correctly? The nipple should move up, so you can appreciate that nipple moves up. So really you're taking your hands and you're pushing that skin up, and I'm pushing back. It's almost like I'm trying to push back into her rib cage. So I'm pushing back and you see the implant is coming down. This is implant displacement. When we do this, typically we start it 3 times a day for 3 seconds. So I push, I hold for about 3 seconds, and that's it. Same thing on the other side. 2 fingers here. I'm pushing and I'm pushing back against her rib cage. You can see here, I can feel her implant, so I know I'm doing this correctly. Common ways that this is done incorrectly is sometimes people push up and down. You have negated the whole point of the exercise when you do that. It is a push up, a push back, and a hold. 3 seconds, 3 times a day to start. Typically what we'll do is we'll adjust massages based on settling, do differential massages in that case. Our second massage is going to be medial displacement, which our model is going to show you how to do. So in this massage, basically what you're doing is you're taking your elbows and pushing in. The sides of the implant are actually touching your arms. You're pushing in and you're holding for 3 seconds, 3 times a day. Just like that. Then our next massage is going to be our swimmer's dive. So in this massage, it really is a true swimming motion where basically we're stretching the implant under the muscle. And that is usually 3 times a day as well. So those are the 3 implant massages. I hope this video helps to kind of explain that. And again, we typically start 3 and 3, 3 times a day, hold for 3 seconds for the relevant exercises. And we increase that if we feel like you need a little bit more time for your implant to settle, or we decrease that if you feel like your implant is settling. Again, with this, trust the process. Don't try to rush the process. It takes 6 months to 1 year for implant to fully settle. So now what we're going to display is breast aug band wear and how to wear it, and just how do you place it correctly, because when placed incorrectly, it can be counterproductive to what we want it to do. So this is our aug band that typically our patients who have breast augmentation surgery, in other words, a new implant placed with or without a lift, will have this placed above to sort of help the implant settle into place. Okay, this is correct augmentation band wear. How do you know it's correct? Look at the augmentation band. It sits above the implants, and you can appreciate it's actually helping the implants not only migrate downward, but preventing them from migrating upward. Let me show you incorrect augmentation band wear. This is incorrect, because what is this doing? This is simply holding the implants in place and not allowing them to settle down. So you don't want to have your augmentation band placed across your breast. You want to think about it as placed above your breast. They should be close to your clavicle, basically preventing, again, implant displacement upwards, but also promoting implant settling down into the pocket. This is not medical advice. If you are a patient of ours, this applies to you. If you have your own surgeon, you wonder what to do for your implants, please go and see your surgeon for advice.